This as the pandemic continues to take center stage in Oregon. Today, Jackson County is reporting 84 new cases, but that low case count doesn't tell the whole story. Newswatch 12's Adam Shum spent the day talking to public health officials. So Adam, what is the whole story?
Well, the whole story, cases continue to rise and the coronavirus pandemic continues to take center stage here in the state of Oregon. Today, the state of Oregon and the OHA announcing another 1,700 new cases. Meanwhile, for the third consecutive day, hospitalizations breaking a new pandemic record. Tonight, more than 700 people are in the hospital battling COVID-19. Let's get to this situation in Jackson County. Alicia, like you mentioned, 84 cases today. That does not even begin to tell the full story. Jackson County public health officials Tanya Phillips tells me that doesn't tell the whole story because of this, because the hospital systems are still overwhelmed. They're still overwhelmed for a number of reasons. Shortage of staff. They're so overwhelmed they can't even contact trace at this point. These cases continue to rise and the Delta variant takes center stage. Public health officials tell me that now is not the time to let your guard down. Hospitalizations are still really high across Region 5. That's Jackson and Josephine County. 164 currently hospitalized while 39 are in the ICU. Meanwhile, Asante, their systems alone have 143 people in the hospital. Their ages range from 2 to 99. The county is still seeing an influx in cases from people 49 and younger. They make up about 70% of cases since the 4th of July.
It doesn't change the fact that COVID is spreading. I want to say it feels rampant in our community, but we have that high transmission in our community. It does not change those facts. It does not change the fact that our hospitals are at capacity. It doesn't change the fact that we have so many cases in a week that we at Jackson County Public Health can no longer investigate every single case. We can no longer, make contact and identify all of those contacts either.
Told me that Jackson County Tanya told me that that case investigation, and contact tracing are the core public health functions. She says take COVID away, and they did this for measles and sexually transmitted infections. This all in order to identify the spread and identify the cluster and be able to put control measures in so that they don't see a large outbreak. Tanya says the same thing that our healthcare systems are seeing. Public health officials are seeing the same type of stress.
One of the things that we're seeing right now are people coming to either our emergency department or our urgent care clinics to get tested, to have a specimen collected for testing. And that's not where we want you to go. We have 2 collection sites, one in Medford, one in Grants Pass. They're drive-through collection sites, so you stay in your car. You're not taking a risk of exposing other people to the virus.
Yeah, Van Sickle reiterates asking the public to don't go to the emergency department. They're already backed up as it is, and as well as going to the urgent care clinics to be tested. Said the collection sites are much safer if you're just looking to be tested for COVID, and it reduces the risk of exposing others to the virus. We do have all those details if you're looking to still get tested on our website, kdrv.com. One of the reasons for the backup log in testing, which is why cases might be a little low today. So if I can kind of explain this to you, they had to transfer people to help with the vaccinations. That took away from people to being helped with the COVID-19 testing. Hopefully the Oregon National Guard should alleviate that. We're going to hopefully learn more of that in the next coming weeks. But for now, we're live in Medford tonight. I'm Adam Shums, Newswatch 12.